So I'm an alternative doctor, and what that means is that I offer alternatives. I'm not anti-medicine. Medicine's done wonderful things. My wife is alive because of medicine, and I'm very, very grateful. However, my wife is not healthy because of medicine. My wife is healthy because we took the alive body that we've got because of the drugs that she's on, for which I am grateful, and we took that alive body and we found out what else needed to get better. And we started putting all the other pieces in place, because keeping her alive wasn't enough. We had to get the metabolism working better. We had to get the sleep right. We had to get the diet right. We had to get the inflammation down. We had to do all of these other pieces that medicine's not very good at. Medicine's really good at acute care, auto accidents, broken bones. They're phenomenal here. The United States is best in the world for that. But the United States is number 34th in the world in healthcare, in health outcomes. And it's because most of the diseases of the modern world are chronic illnesses. And they're chronic because medicine doesn't have anything for them, so they stick around and they just keep on growing. And even when medicine can give you a drug that'll decrease the symptoms and make it easier for you, all it's doing is masking the symptoms. As it masks those symptoms, the underlying cause, the real problem that you have, continues, and it grows, and it gives you more symptoms. And so even if you can get a drug that helps, you're still getting sicker and sicker and sicker, and that's why it's chronic, because it just keeps getting worse. And it spreads throughout the whole body, and you have digestive issues, and you have hormonal issues, and you have fatigue, and your metabolism slows down, and you have brain fog, and you've got all the same set of chronic illnesses, all the same set of chronic symptoms, and it's just some people will have their digestion's worse than others, and so they get the digestive labels. And some people will have the hormonal labels, and some people will have the musculoskeletal labels. But the chronically ill people, they all come in and they've got all the same symptoms, just varying intensities. They're chronically ill because their whole body's breaking down. So we don't want to throw out the baby with the bathwater. If the drugs are keeping you alive or keeping you functional, that's great. But what we want to address is that underlying cause that's buried, and we go through and help that get healthy. And then I had a woman last week come in and tell me that she was off all of her metformin and off all of her insulin because I ignored her diabetes and I worked on what was actually making her sick in the first place. She's healthier. She's not diabetic anymore by any medical standard, as long as she takes care of herself. We address those core causes. That's what an alternative doctor is. It's not anti-medicine. It's pro finding the cause and treat the cause.